Hello everyone, my name is Diyashini and today I'm going to be explaining the nursing surgery task, which is on how to make an occupied bed. So first we have to ask the patient's consent if he or she is okay with us changing their bed. Then we start off by removing the blanket from the patient, the old blanket, and put on the new sheet on the edge of the bed. Then we discard the old blanket at the side and we take the new bed sheet and we will stretch it out beside carefully so that there is no dust or particle that will go on the patient. We will set up the edges of the bed sheet onto the side and we will ask the patient to help us by rolling over to the side of the bed and holding on the handrail. Once the patient has moved to the side, we remove the old bed sheet on one side of the bed first and then we go on by removing the end of the bed also. Then we roll the bed sheet to the middle of the bed where the patient is rolled over and we tuck it under that and also under the pillow. Once that is done, we take the new bed sheet and we put the edge onto the bed by attaching it and spreading it to the middle of the bed also. We will roll the other side of the bed onto the middle of the bed as we did the old one so that it will be easy for us later on. Once we have rolled, we will tuck it under the pillow as well and we will roll it as we did with our old bed sheet and then we will go to the other side of the bed. Once that is done, we move to the other side of the bed and we will ask the patient to roll over the other side of the bed and hold on to the handrail. Then once the patient has rolled over, make sure he or she is comfortable and remove the remaining part of the old bed sheet. Discard the old bed sheet and tuck in the new bed sheet onto the occupied bed, carefully and gently. Once we have tucked in the bed sheet properly, stretch it out and make sure there are no remaining clothes or remaining bed sheets that's left out. Once that is done, ask the patient to move back to their normal position in the middle. Then take their blanket and tuck it on them carefully and gently. Carefully stretch out the blanket onto the patient. Ask he or she if they are comfortable and then stretch out the blanket to the edge of the bed. Then tuck in the ends at the edge of the bed and make a triangle and fold in the triangle carefully to the edge of the bed. Once that is done, do the same thing with the other side of the bed. Gently tuck in the edge of the bed for the comfort of the patient's movement of the leg. Once everything is done, ask the patient if he or she needs anything and is comfortable with what we have done. That is all from me today. Thank you.